In the hills and valleys of Bui Division, healthcare remains a daily challenge for thousands of families. For many pregnant women, children and vulnerable residents living in remote communities, access to quality medical care often means traveling long distances over difficult terrain. Poverty, inadequate infrastructure, and the lingering effects of conflict have further widened the gap between communities and the healthcare they need. Yet, in the midst of these challenges, a new story is being told. On February 16, 2026, the Kounougou Foundation officially launched internally an ambitious initiative aimed at transforming healthcare delivery in some of Bui Division's most underserved communities. The Mobile Health Outreach Project was designed to take healthcare directly to the people rather than waiting for the people to come to healthcare. The vision became reality through the support of Fundación Recover, a Spanish organization dedicated to strengthening healthcare systems across Africa. Their partnership brought not only financial support, but also modern medical technology, including portable ultrasound equipment and digital tools capable of extending quality diagnostic services into remote communities. On April 10, 2026, the project was officially launched to the public in Kumbo. A dedicated team of doctors, nurses, and volunteers set out with a mission to reach communities where access to healthcare remains limited. The outreach targeted 5 rural communities: Dzeng, Kitiwum, Kiyan, Romajai, and Melim. Over the following weeks, mobile medical teams traveled from village to village, conducting consultations, screenings, health education sessions, and maternal healthcare services.
What brought us to carry out this activity? The trained personnel prefer to work in town than to be in the village because of their safety, or also for the benefit of good education for their children. In those villages, no laboratory, no X-ray machine, no ecography, no laboratory for basic disease. Essential drugs in some of these health centers are always not about IV essential drugs that are unavailable. Common health disease who are seen only at the last stage. I will talk about cancer, diabetes, or hypertension. Those these patients diagnosed, they are only the complicated phases. And the other point was the maternal and child healthcare. Very poor. Some of the personnel do not have the skill to diagnose all this type of pathology related to ladies or children. That's what really drawn us to carry out this activity in those selected villages.
The first stop was Dzeng. Between April 14 and 16, healthcare workers attended to residents eager for medical attention. A total of 196 people registered for the outreach program, among them women, children, and men. 74 patients ultimately received consultations and treatment, and for many of them, it was the first opportunity in months to see a healthcare professional.
The story of a 25 years old woman who consulted to us in Dzeng. With the impression the woman was having is that she was not pregnant and she was bleeding, and she was thinking of hormonal disorder. So we started managing as such. But unfortunately, the bleeding persisted. And when she called, we asked her to join us in Kiyan. By then, the echo machine was already functional. So we performed the echography and realized that she was having ectopic pregnancy. She was referred to some hospital and her life was saved.
My name is Madame Priscilla. we back. We be very grateful for the program where Kounougou don't can help we make a move people they really see the need where they get for can consult and we thank them plenty. Say as they go so me they come again for can help the people they need they find.
The outreach then moved to Kitiwum from April 18 to 22nd. The response exceeded expectations. 303 people registered. Women accounted for about 143 registrations, children about 102, and men totaling up to 58. Medical teams consulted and treated 207 patients, and the large turnout highlighted a pressing reality that the demand for accessible healthcare in rural communities remains enormous.
I'm very taking taking for a sheep. A very no, at that talking. Kitiwum could bear if you suje when we are jung. There's 7 Yogaji, very haven't paid. You're only Kiamo, I share very haven't been.
In Kiyan, the mobile clinic operated between April 21 and 23. 179 residents registered, and of these, 101 received consultations and treatment. Women represented the majority of beneficiaries, reinforcing the importance of bringing maternal health care closer to rural communities. Portable ultrasound technology enabled pregnant women to receive essential prenatal examinations without leaving their communities.
We'll be very proud, very glad for this opportunity where a foreigner for Romajai village. You know, say it's not easy for me they want share something, so even as it like how they how make a come land for our village. We'll be very proud and we'll be very glad. We talk to them, welcome.
The time the outreach reached Romajai between April 28 and 30, awareness has spread across neighboring communities. The numbers reflected growing confidence in the program. 374 people registered, 213 were consulted, and the community recorded the highest participation rate of the entire campaign. The figures demonstrated not only trust in the project, but also the scale of unmet healthcare needs in rural Bui Division.
Here in the name of Romajai community, to say great thanks to the Fundación Recovery. I thank them very much for what they have done to my community. We are very grateful to welcome them and we will continue with them next time. We would like to encourage you people and we are still having hope, waiting for you people of the next chance.
So the first thing I said, thank you, pardon, mother. It be rather unfortunate, say, what people them, we are not finished up. I will talk them straight. Yeah. I'm not even being talk. Yeah. So when they sit there for quarter.
Thank you for it.
So when they won't come, where tea time don't short. So when they won't come, where I don't know whether our jobs we don't finish. We expect like tomorrow.
Population.
I be straight for what you want to talk. When I won't come tomorrow, when I don't get more than the population, when I get and trade damage at the line.
Yes.
The final outreach took place in Melim from May 5 to 7. The response was remarkable. Every person who registered received medical attention. 76 of them were women, 15 children, 24 men, making a total of 115 residents who registered, and all 115 received consultation. It was a fitting conclusion to weeks of dedicated services across the concerned communities.
I'm very happy for this campaign that just came. I'm a pregnant woman and photographer, my baby is very and I'm very grateful for this campaign. I'm so happy. So thank you guys so much. Thank you guys.
And today we want to thank the Kounougou Foundation and its partners for visiting Melim health area today. Today we have had a free consultation, free laboratory, free ultrasound, and free medicines that have been given to the people that came out for consultation. So we want to appreciate the Kounougou Foundation and its partners for reaching out to the community of Melim.
The Mobile Health Outreach Project was about building healthier communities. Community health volunteers received training on hygiene promotion, nutrition awareness, and malaria prevention. The goal was clear enough to ensure that knowledge and health promotion continue long after the mobile clinics have departed. By empowering local volunteers, the project invested in long-term resilience and community ownership.
Shay Fonka Bernard from Dzeng, a trained volunteer who has come to represent the people from Dzeng, and we have come here to say thanks to the Fundación Recover for what they have done to the people of Dzeng. We really appreciate their coming and reaching us in Dzeng.
Yeah, I'm a trained volunteer from Romajai. I thank this community for what they have done in my village. This health, something concerning health, it is good for the community, and for what they have done in my village, I see that it is very good.
My name is Banyela Gayene, a support staff. I wish to thank Fundación Recover so much for this wonderful initiative, for giving us the opportunity to go to communities, to these various communities we went to meet the health needs of the population. At least it was a wonderful experience, bringing smiles to the people. I wish to thank them very, very much.
I am Tume Emmanuel Alanya, one of the team members. So I wish to add to my own voice to say thank you to Fundación Recover that has restored hope, that has brought health. For we know health is wealth. The population of Dzeng, Kitiwum, Kiyan, Romajai and Melim are very happy. They are so happy. We saw in their faces, we saw the way they went back home with their packages, with their consumables, their drugs, especially the children, the pregnant women. Everybody is just happy. So we wish to thank you enormously for that support, and we continue to beckon on you so that we should continue to put the smile on the faces of our vulnerable population.
The more important thing, the impact that this project has done to this community is that 70% of patients complaining of abdominal pain was properly managed locally, and 30% who are referred out are referred now with the exact reason of referral.
From April to May 2026, the Mobile Health Outreach Project achieved amazing results. Across 5 communities, 1,167 residents registered for healthcare services. A total of 710 consultations were conducted. Hundreds of women gained access to maternal health care. Children received medical examinations and treatment. Men accessed health services that were previously difficult to reach. Behind every number is a beautiful story. A mother reassured about her pregnancy. A child treated before illness became severe. A family spared the burden of traveling long distances in search of health care. The Mobile Health Outreach Project demonstrates what is possible when local commitment meets international solidarity. Through the partnership between the Kounougou Foundation and Fundación Recover, healthcare has moved beyond clinic walls and into the heart of rural communities. For hundreds of families across Bui Division, quality healthcare is no longer a distant aspiration. It is a service that arrived at their doorstep. and a reminder that even in the most challenging circumstances, hope can travel.